Hi, I'm Judy. I am going to be doing a piggyback intermittent venous infusion of medication. My GPSP's been done, my 11 rights. I have verified the solution with the EMR and the medical order according to facility policies. I've clarified any consistencies. I've checked for allergies with the chart and with the patient. I've checked for color, leaks, expiration dates. I checked to see if the medication needs to be diluted and the IV fluid. I've checked the IV infusion rate. I have checked compatibility, and with the medication, you only prepare one medication for one patient at a time. I needed to know the special nursing considerations, the actions, the safe dosage ranges, the purpose of administration, and adverse effects. I would put on my PPE if indicated. I would do my 3 administration checks with the checking with the EMR, the medication order, and the patient. I would scan the bar if necessary. I would pull up any medications out of the vial if needed to be in. I would do any calculations if needed to be in. I would check the armband of the patient. I would identify the patient with the armband ID number with their name, date of birth, according to facility policies. I would assess the site to see if there's any inflammation, infiltration, or any complications at all. And if I was using an IV pump, I would pause the IV pump and administer my medication and then restart the pump again. I'm going to go ahead and explain to the medication or the purpose of the medication to the patient. I would ensure to receive, to do the medication at the correct time. I would provide the patient with privacy. I would lock the medication room or drawer, whatever needed to be doing before I left and brought my stuff in here. Okay, I'm going to go ahead and do my hand hygiene. And I already gathered my stuff up and I brought it in here. I've got my IV port ready. I've already done it in the first video. It's ready to go to be able to hook up my saline. And I am doing sodium chloride 50 mLs today. Okay, I'm going to do my hand hygiene again. Put on my gloves. And I'm going to do my IV. Get it all set out. Get untangled here. Maybe not. Okay, got it all untangled. Now I'm going to be using a sterile technique. Take my IV, unhook that, pull that off. Using sterile technique, doing the push and pull, or push and twist method. Pushing it in, priming my IV bag up. Hang it up, then I can go ahead and prime it. And cap it here. Prime my line up, make sure there's no air bubbles in it. Hope you can see that. I'll put the trash can back here a little bit just in case you can't. Check the line. Okay. It's all done. done. Now that's all primed up. Need to get me an alcohol pad and then clean my IV port, my J-lube. Clean it thorough. Okay. Need to flush it. I'm going to pull back till I see blood return coming. And then I'm going to flush it slowly and gently. Yeah, gotta make sure I unhook this first. There we go. Always make sure you release it. Okay. Oh yeah, I've got it. You flush it probably 5 to 10 mLs. Lock it back off. Dispose of it. And then hook up my IV. And that's ready. Okay, I would put a cap on this end, cap on each one of the ports. Now I can go ahead and do my potassium chloride. Let me pull this off first. It'll be easier. Pull this off. This off. Do my push and twist method. Some one's a little bit harder than others to put in. Make sure I'm not contaminating anything on either one of the IVs or ends or anything. Okay, I've got that set up there. Prime it up. It's about half. Same as the other one. I would drop my IV down, lower than what my secondary bag is. And I would adjust the medication. I would adjust the medication rate of the gravity. Now I need to get another, and then I would readjust the primary. After I adjusted that, I would readjust the primary. I'm going to clean this. Make sure I prime this up real good. Take my cap off. Woo! Well, that's what I get for not locking it. Remember to always lock it. Make sure there wasn't no bubbles in it. Let it, air dry for 30 seconds before I put it together. Then I will go and adjust the flow rate according to the orders. I would readjust the primary rate for the IV. I would come back periodically and check the medication bag and the IV bag and check the port side of the patient. I would got labels here. I would label and date with the date and time of each one of my lines, main line and the secondary, with date and time on them. So that way if another shift comes or whatever, they would know when it was put up there. And we'll go document my medication, my dose, my site. I would document the time. So I would document the medication, the dose, the route, the time, the site, and then I would come back and I would evaluate and assess the patient's site. I would come back in a lot of time and check the medications with the IV and the sodium chloride. And when the sodium chloride was done, I would take it off and I'd readjust the IV, pull it back up to where it needs to be, and I would readjust the flow rate on the IV. I would clean up my mess and go do my documentation. Thank you.